Hello everyone, welcome back to my channel. Those who haven't subscribed, please do subscribe so that you will get updates on my future videos. In this session, I will be taking aortic arches and its derivatives. In my UG days, aortic arches and its derivatives were always a nightmare for me. I don't know how many of you felt so. So I just thought I will give you an overview about the aortic arches, and I promise you, if you understand the concept and study, you won't go wrong in solving any of the entrance questions, and also you will find it easy to answer all the questions for the university exams as well, because this is one of the favorite questions again for the examiners. So before moving on to the aortic arches, I have done two sessions, one the development of heart tubes and the other one the development of the pharyngeal arches. Please do view these sessions so that you will get a clear idea about the aortic arches. So let's begin. Aortic arches, before coming to the aortic arches, in the developing embryo, on either side of the body, in the beginning, there are two primitive aortae. You call it as primitive aortae. So, if you just have a look from the lateral aspect, you just imagine this is the foregut. Okay, so you just imagine this is the foregut. I have already mentioned that there are two primitive aortae on either side of the body. Okay, so when you're having a look from the side, you just imagine that this is the foregut. And you have the primitive aortae like this. So this is the primitive aortae. So like this you have on both sides. On the right side you call it as right primitive aortae. On the left side you have the left primitive aortae. This is the schematic representation of primitive aorta. Now let's mark the parts of the primitive aorta. So if this is the foregut, the part which is lying in front of the foregut, you call it as ventral aorta. That is known as the ventral aorta. Now, what do you call the part which is lying behind the foregut? That is known as dorsal aorta. And the one which connects the dorsal and ventral aorta, you call it as aortic arch. Okay, so you have the right and left primitive aortae. You have three parts for each primitive aortae. That is, the part which is lying anterior to the foregut, you call it as ventral. The part which is lying posterior to the foregut, you call it as dorsal. And the part which connects the two aortae, the dorsal and ventral aortae, you call it as aortic arches. Now, what do you mean by aortic arches? So these are the vessels connecting dorsal and ventral aortae and which are passing through the pharyngeal arches. Since they are passing through the pharyngeal arches, you call it as aortic arches. Okay, so we have how many pharyngeal arches? There are 6 in which fifth one will usually be degenerating. Likewise, we have in the beginning 6 aortic arch arteries where you will get the fifth one disappearing like the pharyngeal arch. So ultimately there will be 5 aortic arches. Okay, so this is about a rough framework of how the aortae are seen in the body. Now you might have seen the session on the development of the heart tube. So this is the development of heart tube. You can see in the beginning there were 2 endothelial heart tubes which got fused together to form a single heart tube. Okay, so in the cranial end you had a truncus arteriosus. So what happens is, on the ventral aspect, that is the ventral aortae will get fused. That is, this fused end of the ventral aortae will fuse with the truncus arteriosus of the heart tube. So this fused end of the ventral aortae, you call it as aortic sac. Okay, so the fused part of the ventral aorta, you call it as aortic sac, and that is actually just fitted on the truncus arteriosus. And the unfused portion of the ventral aorta, you call it as right and left horns of the aortic sac. Right and left horns of the aortic sac. Then you have the aortic arch. So these are the aortic arches. This is the right aortic arches. This is the left aortic arch, and the one which is going down, that is actually seen on the posterior aspect of the foregut, that is known as dorsal aortae. Okay, so ventrally you have the 2 ventral aortae fuse together to form the aortic sac, which is just merging with the truncus arteriosus of the heart tube. Then the unfused portion, you call it as right and left horns of the aortic sac. Then you have the aortic arch, then you have the dorsal aortic. So this is the beginning of the aortic arch. So it is the first arch which is formed in the beginning. Now what happens is, as soon as the pharyngeal arches are developed, there will be a communication between the ventral and dorsal aortae through the pharyngeal arches. That is how you get all these named aortic arches. You have the first arch passing through the first pharyngeal arch, second through the second pharyngeal arch, third through the third pharyngeal arch, likewise fourth. But fifth you are not seeing. Why? Because the fifth pharyngeal arches itself is disappearing. So you will get only the sixth one after fourth. So this is how you get the aortic arches on either side, on the right side as well as on the left side. So you can see that the dorsal aortae. So this is the dorsal aortae. Okay. So this is actually a schematic representation. This is not a 3D representation. This is just to understand. So you have to have a 3D view in your mind when you look at this. Okay. So this is the ventral. This arches through the pharyngeal arches and then goes back as the dorsal aortae. When you have a look at this, you can see that this dorsal aortae you get on both sides, that is on the right and left side, corresponding to the pharyngeal arches. Or you can say that where the aortic arches are present, in that region you will get paired dorsal aortae. But after the aortic arches, what happens? You can see that the dorsal aortae from either side fuse together to form a single dorsal aortic. Okay, so the dorsal aortae will remain separated or remain as paired dorsal aortae in the region of aortic arches, and after the formation of aortic arches, the remaining portion of the dorsal aortae will just fuse together to form a single dorsal aortic. Now we have to see what are the changes happening for the aortic arch. So just to mention about the region supplied by the aortic arches, we know that the pharyngeal arches are seen in the neck region. So the branches of the aortic arches are mainly supplying the head and neck, and the dorsal aortae will be supplying the rest of the body parts. So that is how the branches are derived from the aortic arches. So we will be mostly concentrating on the derivatives of the aortic arches. So let's see one by one. First, what happens is, there are 5 aortic arches, 1, 2, 3, 4, it's not 5, it's 6. Okay, so first you have to keep that point in mind. Now let's see what is going to happen for these arches. The first and the second aortic arches. Okay, so the first and the second aortic arches just disappears. Understood? You just remove the first and the second aortic arches. It is easy to remove, right? You just remove the first and the second aortic arches. I will just rub it off later. I have to say something about the first and second aortic arch. Now you are getting the aortic arch from the third arch onwards. Okay, so first you remember that the first and the second aortic arches are just disappearing, but sometimes a part of it will be remaining there, and the remnant of the first aortic arch is forming the maxillary artery. Okay, so the first aortic arch, first and second aortic arch just disappears. The remnant of the first will be giving rise to the maxillary artery, and what happens to the remnant of the second? The remnant of the second is giving rise to the formation of hyoid and the stapedial artery in the fetal life. Okay, so hyoid and stapedial artery from the second arch, and from the first arch you have the maxillary artery. Now I am going to remove the first and second arches. Now there are no more contributions from the first and second arch. Is that clear? Now let's see. So please have a look at this diagram. I know the diagram is a little bit awkward, but still you can see that the major structures formed from the third, fourth and sixth are, you have the common carotid and its branches on the left side. You have the right common carotid and right subclavian arising as the brachiocephalic trunk on the right side. Then you have the left subclavian artery arising from the arch of aorta, and then you have the pulmonary arteries. So these are the arteries which are going to be derived from the remaining aortic arches. So we are going to focus on how these arteries, how this diagram is made from this diagram. That is what we are going to focus. Okay. So at this point, I would like to mention one important point. You can see third, fourth and sixth. Okay. So we have already mentioned about the aortic sac. Okay. So the third and fourth arch arteries. So if you consider if you consider my fist as the aortic sac, the third and fourth will be opening into the ventral aspect of the aortic sac, whereas the sixth will be opening into the dorsal aspect of the aortic sac. Okay, so third and fourth onto the ventral aspect and sixth onto the dorsal aspect. And third and fourth will be having blood from the ascending aorta of the truncus arteriosus. Okay, so third and fourth will be carrying blood from the ascending aorta of the truncus arteriosus, whereas the sixth one will be carrying blood from the pulmonary trunk of the truncus arteriosus. So this is a concept which you need to know. So at this point itself, you know that third and fourth are going to be branches of the aorta, whereas sixth is going to be the branch of the pulmonary trunk. Okay, so at this point, major doubt is cleared. If you remember this single point, third and fourth arising from the ventral aspect of the aortic sac, and sixth is connected to the dorsal aspect of the aortic sac. Third and fourth will be carrying blood from the ascending aorta of the truncus arteriosus, and the sixth, that is the pulmonary artery derived from the sixth, will be carrying the blood coming from the pulmonary trunk of the truncus arteriosus. Okay, so you just keep that point in mind. So third and fourth are branches of the aorta, whereas sixth is mainly from the pulmonary trunk. Now let's see what is going to happen. So there is the third arch, there is the fourth arch. So there is a connection between the third and fourth arch. So this portion is actually the dorsal aorta, right? So this portion is known as ductus caroticus. Okay, ductus caroticus or carotid duct. That means the dorsal aorta which connects the portion of dorsal aorta seen between the third and fourth arch. That is known as ductus caroticus or carotid duct. What happens to this duct? It usually disappears. So this connection between the third and fourth usually disappears. You got it? So we can just remove the connection between the third and fourth through the dorsal aorta. Understood? So that is ductus caroticus or carotid duct. You might get a MCQ on what do you mean by ductus caroticus. It connects first and second, third and fourth, second and third, like that. So it is between the third and fourth, the dorsal aorta, between the third and fourth you call it as ductus caroticus or carotid duct. That usually disappears. Okay. Now let's focus on the third arch. So this is the third arch. Okay. So this is the third arch on the right and left side. So let's see what are the changes happening to the third arch. There will be a bud from the third arch going upwards. This is known as external carotid artery. Okay, so this is forming the external carotid artery. So the bud from the third arch is forming, which grows cranially on both sides. They are forming the external carotid artery. The remaining part of the third arch, okay, distal to the external carotid artery, and a cranial elongation of the dorsal aorta. Okay, and the cranial elongation of the dorsal aorta forms the proximal portion of the internal carotid artery. Okay, so the third arch, which distal to the bud of the external carotid artery, along with the cranial portion of the dorsal aorta, forms the internal carotid artery. So you are getting a picture like this here. Okay. Now what you have to see is, you have the fourth arch. Okay, so this is the fourth arch on the right side and this is the fourth arch on the left side. Now you can see that there is a seventh intersegmental artery. Seventh intersegmental artery getting connected onto the fourth arch. What do you call this? The seventh intersegmental artery. So the seventh intersegmental artery is getting connected to the dorsal aorta, which is in continuation with the fourth arch. So on the right side, the fourth arch along with the seventh intersegmental artery. So this is the seventh intersegmental artery. Okay, so on the right side, the fourth arch along with the seventh intersegmental artery, they are actually giving rise to the right subclavian artery. So the fourth arch along with the seventh intersegmental artery giving rise to the right subclavian artery. But whereas on the left side, just this seventh intersegmental artery is forming the left subclavian artery. Why is it so? Why this fourth arch is not contributing to the formation of left subclavian artery? What could be the reason? Here on the right side, we mentioned there are two derivatives for the right subclavian artery, that is the fourth arch as well as the seventh intersegmental artery. But whereas on the left side, we are just saying that it is just the left seventh intersegmental artery which is giving rise to left subclavian. What about the fourth arch artery? At this point, we have to remember one thing. We have the formation of aortic arch of aorta. So the arch of aorta is actually formed from the fourth arch. We will come to the portions from which the arch of aorta is exactly formed. But here you just remember that on the right side we mentioned fourth arch along with the seventh intersegmental giving rise to right subclavian artery. But on the left side we have just the left seventh intersegmental artery which is giving rise to left subclavian artery. Okay. Now I would like to add one point here. We know that there are three branches for the arch of aorta. You just remember the three branches. This is the arch of aorta. You have the brachiocephalic trunk, you have the left common carotid, and you have the left subclavian. So these are the three branches from the aortic arch. So on this right side you have the brachiocephalic trunk. So you can see that this is the brachiocephalic trunk. Okay, so this is the brachiocephalic trunk. So this brachiocephalic trunk is actually formed from the right horn of the aortic sac. Okay, we mentioned about the aortic sac and the right and left horns, isn't it? So this right horn of the aortic sac is giving rise to the brachiocephalic trunk. Okay, so the right common carotid artery and right subclavian artery are coming from this right horn, that is the brachiocephalic trunk on the right side. So what about the left side? Left side, we know that the left common carotid, this is the left common carotid, this is the left subclavian. So these two are actually coming from where? The arch of aorta. So these portions should give rise to the arch of aorta. So arch of aorta is derived from the aortic sac, the left horn of the aortic sac, as well as the fourth arch artery. So you have the aortic sac here. Okay, so you have the aortic sac here, you have the left horn of the aortic sac here, and you have the fourth arch artery. Clear? So this is actually giving rise to the arch of aorta. Once again, the left horn of the aortic sac, the left horn of the aortic sac, and the fourth arch artery giving rise to the arch of aorta. So the arch of aorta is over, the brachiocephalic trunk is over, you have the common carotids and subclavians on either side. Now one important point I would like to mention here is, the dorsal aorta, the remaining dorsal aorta on the right side after the point of entry of the 7th intersegmental artery just disappears. Okay, on the right side we can see that the dorsal aorta up to the point of merging with the dorsal aorta of the opposite side, it just disappears after the point of merging of the right 7th intersegmental artery. We are not going to see the dorsal aorta anymore. But on the left side it persists. The dorsal aorta on the left side persists, and this is actually giving rise to the formation of descending aorta. Okay, so you have the ascending aorta from the truncus arteriosus, arch of aorta from the aortic sac, left horn of the aortic sac and the 4th arch artery, and the remaining dorsal aorta on the left side will be giving rise to the descending aorta. So that's about the development of aorta. Now one more artery is here. This is the 6th arch artery. Okay, 6th arch artery is actually dorsally placed. We mentioned that the aortic sac, ventrally you have the communication of the 3rd and 4th, and dorsally you have the 6th arch. Hope you remember that. Okay, so from the 6th arch you have a bud. Can you see a bud coming from the 6th arch? So this bud is going to the developing lung, and this is actually known as the pulmonary artery. Okay, so from the 6th arch you have a bud which is going to the developing lung, and this will be actually giving rise to the pulmonary artery. So on the right side you can see a portion of the 6th arch artery which is remaining, okay, beyond the lung bud. So this actually disappears. So this part of the 6th arch artery beyond the formation of lung bud just disappears. Okay, but on the right side the region of the the 6th arch artery which is connected to the dorsal aorta persists. Here on the right side you are not getting it because there is no dorsal aorta to maintain communication, so it just disappears. But on the left side it is seen connected to the dorsal aorta. So what is this connection known as? This is our ductus arteriosus. So the 6th artery which is connected to the dorsal aorta beyond the lung bud is known as the ductus arteriosus. Okay, so the 6th arch is mainly giving rise to the pulmonary artery which is in continuation with the pulmonary trunk formed from the truncus arteriosus. Okay, so these are the derivatives, and I would like to add some applied aspects at this point so that it will be more clear for you. Sometimes this ductus arteriosus persists, and that condition, what do you call that condition? That is known as patent ductus arteriosus. Another important thing is there will be narrowing of the aorta. Narrowing of the aorta either proximal to the junction of the ductus arteriosus or distal to the junction of the ductus arteriosus. So the aorta will just get narrowed down proximally or distally. Okay, so this is actually said to be the migration of the cells which go to occlude the ductus arteriosus, which will be extending to occlude the aorta. That is how the pathology is mentioned in case of coarctation of aorta. So that condition is known as coarctation of aorta. So coarctation of aorta, it can be either preductal if the cells are going cranially or postductal if the cells are migrating caudally. So that is actually the preductal and postductal coarctation of aorta. Now another important thing is, we mentioned that on the right side the entire dorsal aorta is just disappearing. Sometimes it might persist. So what happens? You have two arches, double aortic arches. You have one on the right side and you have one on the left side. So that is what is meant by double aortic arches. Or sometimes what happens is the subclavian artery might take its origin from the dorsal aortic. So if this connection is just persisting like this, the intersegmental artery will be connected to the dorsal aorta, but this communication will be lost. So what happens? The right subclavian artery will be coming from the left side. That is actually known as the aberrant origin of the right subclavian artery. So these are some of the variations which you can expect during the course of development of the aortic arches. So I would like to give a briefing about the derivatives of the aortic arches. Please have a look, because I've got comments like the topic I should summarize towards the end so that you will get a glimpse on it in a neat format rather than having a look at this board, because the board will be actually towards the end, you won't be able to read the board. So I will just have a PPT showing all the derivatives of the aortic arches. Please have a look. So the external carotid artery on the right side, it is from the carotid bud of the third arch. On the left side, it is again from the carotid bud of third arch. Internal carotid artery, again same origin on the right side and left side. It is from the third arch and the cranial elongation of the dorsal aorta. Common carotid artery, again it is derived from the third arch. Subclavian artery, on the right side you have the fourth arch along with the seventh cervical intersegmental, but on the left side it is just developed from the seventh cervical intersegmental artery. The brachiocephalic trunk is derived from the right horn of the aortic sac, whereas arch of aorta, it is derived from three important structures, that is the aortic sac, the left horn of the aortic sac and the fourth arch artery. Pulmonary artery is actually derived from the sixth arch artery. Ascending aorta and pulmonary trunk, they are actually derived from the truncus arteriosus by the formation of the spiral septum, and the descending aorta is the persistent dorsal aorta on the left side, that is giving rise to the formation of descending aorta. So these are the derivatives derived from the aortic arches. Now let's see some of the questions which are asked from this topic during the NEET PG exams. Let's see some of the questions one by one. The first question, which takes part in the formation of right subclavian artery? We already mentioned that the subclavian artery on the right and left, right, we have two structures from which the right is formed, whereas on the left side we have only one. Let's see the options. A, second arch artery, fourth arch artery, seventh arch artery and all the three. Here the confusion will be between fourth and seventh, but you have to remember one thing, it's the seventh cervical intersegmental artery, it's not the seventh arch artery. We don't have any seventh arch artery, right? So out of fourth arch artery and seventh cervical intersegmental artery, we have only one option, that is the fourth arch artery. Now the next question, artery of second pharyngeal arches. We have mentioned about the derivatives of the second pharyngeal arch, the remnant of the second aortic arch. The options are maxillary artery. Actually, maxillary artery is the remnant of the first aortic arch. It is the stapedial artery. We don't have the hyoid artery in the option. So the option is stapedial artery out of the four. Now the next question is artery of third arch. So we have mentioned that the third arch is actually giving rise to both external carotid, internal carotid and common carotid. So out of the three carotid arteries, the option here is the common carotid artery. It's not maxillary and stapedial or pulmonary, it is the common carotid artery. Now the next question is right fourth arch artery gives rise to. Again we have mentioned it several times. Right fourth arch artery, on the right side it is actually giving rise to the right subclavian artery, whereas on the left side I have mentioned it is actually giving rise to the formation of arch of aorta. So they are asking about the right fourth. So it is the right subclavian artery. Anyway, the arch of aorta is not here, so there is no more confusion. So it is the right subclavian artery. Now the next thing is double aortic arch occurs due to. So double aortic arch, I have just mentioned, usually what happens is on the right side, the right dorsal aorta usually disappears, right? So if it is persisting, you will get two arches on both sides. You have the left arch as well as the right arch. That is what is meant by double aortic arch. And sometimes what is said is in this condition, the right aortic arch will be actually going behind the esophagus and trachea, and that will actually forming a double aortic ring, and it will result in symptoms pertaining to these structures. Now the next is the commonest variation in the arteries arising from the arch of aorta is. So the commonest. So there is absence of brachiocephalic trunk, the left vertebral artery arising from the arch, left common carotid artery arising from the brachiocephalic trunk, presence of retroesophageal subclavian artery. So out of these four, the commonest variation according to references is the left common carotid artery arising from the brachiocephalic trunk. So that is said to be the commonest variation in the arteries arising from the arch of aorta. So that's about the derivatives of aortic arches in a nutshell. Thank you for watching.